Hey YouTube. So I've got a lot of questions about my hormone sort of regimen or whatever, and so I wanted to make a video to address that. So in order to get hormones, I actually started by seeing a therapist, trying to follow the traditional standards of care method. And so that meant seeing a therapist for 3 months and then getting her recommendation to start hormones. But after 3 months of seeing my therapist, she actually wouldn't write me the recommendation. So I was actually able to just go directly to my doctor and ask her for the hormones, and thankfully she was pretty progressive in that regard and went ahead and wrote the prescriptions. And so before that, I had seen her and kind of told her about my plan of transition, and actually had needed to get my cholesterol down before she was wanting me to start hormones. And so I had done that, got the blood test, everything showed up good, and after I banked sperm, I started taking them. And I started out with a drug called prempro, which is, I think, a birth control drug. And so I started out with that, and 200 milligrams of spironolactone, I think it's pronounced, spiro, the anti-androgen or testosterone blocker, if you would. And about 3 months in, another blood test showed that everything was fine, and so we upped my estrogen dose. And so in order to do that, we had to take me off of the prempro and put me on actually estrogen itself, a 2 milligram dose, and a progesterone, I think it was a 10 milligram dose. And so the prempro is actually a estrogen and progesterone kind of combo pill, which is why she started me on that. And then about 3 months later, my doctor, to her credit, was actually fantastic about really letting me set my pace in terms of upping my doses. And so 3 months later, so 6 months into hormones, I bumped up to 4 milligrams of E and stayed on the 200 milligrams of spiro, because that's really considered the max safe dose. And took that all throughout the summer, and I was actually out of town for my internship for about 3 months. And so when I came back, new blood tests showed that my testosterone had started to decrease. My estrogen levels were increasing, but not to where I wanted them. So we bumped me up to 6 milligrams of estrogen, and that lasted until sometime in November or December. So that was another 3 months or so before I was prescribed to 8 milligrams of estrogen. So over the course of the first year of hormones, it was really a small, tiny amount of EMP in the beginning, P being progesterone, then upping the estrogen, decreasing the progesterone, and then eventually we took me off of the progesterone because I was having a skin irritant side effect, which still actually kind of persists to today. I don't know if you can see, probably not, but my skin really gets irritated pretty easily. It's a lot like an eczema or eczema. But yeah. And so basically every 3 months I increased my estrogen dose by 2 milligrams to 8 milligrams, which is the sort of max oral dose. And then we took me off of P and kept me on the same anti-androgen. And so as of my last blood tests, which were taken right in August of this year, so that would be about 18 months, My testosterone levels are basically non-existent, and my estrogen levels are well within the normal range for females. And what I did notice is that a lot of the development really started to speed up once I started the higher dose. But some of the effects are really kind of immediate and noticeable from the beginning. So like 3 days in, my skin was all of a sudden way more sensitive. Within a couple of weeks, I started noticing new erogenous zones, and really, those were the main side effects that were really kind of obvious. My skin getting a little more sensitive and weaker was something that came a little bit later. Probably the only unpleasant side effect I've had. And then I think everybody else has done a pretty good job of covering a lot of the other things, like how much more emotional you become. Like, I've always been a pretty even-keeled type of person, and I like to think that for the most part I still am, but I still have my up days and my down days, and my frustration with having job offers revoked, which just happened to me recently. So, but yeah, I guess if there are other specific questions people might have about hormones, feel free to ask in the comments below, and I will try to answer them as best I can.